Hello fellow med students. So the first emergency condition that we will be covering here is the tension pneumothorax. So before jumping on to the management, we will first see what it is and what exactly is its pathophysiology. So here the air leaks from the lungs into the pleural cavity via a ball valve leak. So what is this ball valve leak and how is this important to know? So basically the ball valve leak will allow the air to exit from the lungs into the pleural cavity but will not allow the same air to go back into the lung. So how is this problematic here? So basically the air will be entrapped into the pleural cavity, which will cause increase in the intrapleural pressure. Now this increase in the intrapleural pressure will cause collapse of the lung, and it will also cause the shifting of the mediastinum to the opposite side and prevent the cardiac filling, and will eventually result in decreased cardiac output. So to understand this exactly, we will take an example. So let's assume that the pneumothorax is in the right lung. Okay, so now it will push the mediastinum to the opposite side, that is onto the left side, and we all know that on the left side we have our dearest little heart. So it will cause the compression of the heart, which will cause decreased cardiac filling, and hence it will cause decreased cardiac output. So this was the pathophysiology of the tension pneumothorax. Before ending this, we here have a very important chest x-ray of the posterior anterior view, and we can clearly appreciate here the left-sided pneumothorax. Hello fellow med students, now we will see the management of the tension pneumothorax. So the steps involved in the emergency management of the tension pneumothorax are as follows. The first step is the emergency insertion of the needle. We will have to use a large bore needle of 17 to 18 gauge. Now the most important and the frequent question that the examiner will ask you is that where exactly do we have to enter this needle? So if the tension pneumothorax is in the right side, we will enter it in the second intercostal space in the mid clavicular line, and if it is on the left side, we will enter it from the fifth intercostal space in the axillary line. We have to insert the needle after local infiltration with 2% procaine hydrochloride. Now what exactly do this needle do when it enters the pleural cavity? It will basically help the air to escape from the pleural cavity, which will make the patient comfortable. Now we have to connect this needle to a underwater seal, which is further connected to the electric suction pump. This electric suction pump right here will provide a negative pressure of 20 to 30 centimeter of water. The second step is the oxygen administration. So we have to give the patient humidified oxygen at high flow rate 8 to 10 liters per minute to relieve the anoxia and the cyanosis. The third step is treatment of the shock. So when the air will escape the pleural cavity, the patient will automatically be relieved from the shock as well, but if the medullary centers are involved, it may take few minutes to few hours to get resolved. So till then we can provide the patient with the IV fluid, we can give them vasopressors, or we can even give them respiratory stimulants. The fourth step further is if it is associated with hemothorax or the pyothorax, so we have to do the removal of the respective fluid through incision and drainage in the lower intercostal space. And the fifth is treatment of the cause. That can be either infectious cause or a trauma like tuberculosis or any injury to the ribs, which can cause the tension pneumothorax. Thank you.